I have to say that the biggest thing that I've noticed from yourselves, Alcohol Action Ireland, and some others on social media going back a few weeks, is about the postponement of health labels on alcohol bottles and cans coming in Ireland. Sheila, can you tell me more about this story?
Surely indeed. So, Ireland has actually been to the forefront of its legislation, which from May 2026 will require that all alcohol products will have to have health information labelling on the product. And these are, straightforward text-based labels. They say things like, alcohol causes liver disease. There's a link between alcohol and fatal cancers, a warning about not drinking in pregnancy, and some basic information about calorie content and alcohol content in the product. So very straightforward, but it's legislation that has taken the best part of 10 years to get to this point. And as I say, it's due to come into effect from May 2026. Now, what has been really concerning us is that over the last few weeks, there have been indications from senior government figures that they are considering postponing or delaying the implementation of those regulations. And this has been couched in, I suppose, in relation to tariffs, and that, we have a changed trading environment, and that we somehow have to, or Ireland somehow has to give more support to the alcohol industry. And one of the ways in which they perceive this is by delaying the introduction of these labels. Obviously, we are campaigning strongly against this, and it's not just us. I will tell you that there's been over 75 organisations and advocates right across the country have been writing to the government on this particular issue. Multiple international groups have also done the same as well. Pointing to Ireland's leadership in other public health matters. For example, the ban on smoking in public places. So, we are expecting an announcement one way or the other on this in the next, couple of weeks. But what we are saying is that the arguments that have been put forward about this in relation to changes in trading environments, these are the same arguments that have been made repeatedly by the alcohol industry throughout the long and detailed processes that this legislation has already gone through, because essentially the alcohol industry does not want consumers to know the risks from alcohol. They fear that it might actually reduce the level of consumption in the country. And that's actually what it comes down to. And this is the point that we are making repeatedly over and over again, that this legislation is there for a good reason. If you were to look at it from the point of view of fetal alcohol spectrum disorder, there's 15 babies born every single day with FASD, a lifelong neurodevelopmental condition. If we're to look at it from the point of view of cancer, there are 3 people getting a diagnosis of cancer today that has arisen because of alcohol, and yet they don't actually know that. This is something that's very much not in the public psyche, that actually alcohol does cause cancer. So those things haven't changed. And the arguments from the industry, while they might be glossed up and use different, ones at different times, they come back to the same basic point. The alcohol industry does not want labeling, does not want health information labeling on their products.
Okay, I understand that within government it was is the Minister for Enterprise, Peter Burke, who was pushing for the change. Would it be possible, Sheila, for the introduction of health labels to come in within Ireland only and not abroad, like?
Well, the labels actually only apply to products which are sold in Ireland. So they actually have no impact at all on Ireland's exports, which is something that we've been really pointing out, because when this was first mooted actually by Pascal Donoghue back in April, he said, oh, well, this is to support Ireland's exports. But in fact, the labelling has no impact whatsoever on Ireland's exports. And indeed, as it is, the alcohol industry already produce different labels for different markets. When they're exporting to America, for example, they have to have a specific label there for particular conditions they have. They also export into different countries with different languages, and there are other different statutory requirements. So this is an industry that is well used to and well able to deal with different conditions in different markets. What they do not want is for people to be aware of these very specific risks, such as the link between alcohol and fatal cancers.
I just personally don't understand the rationale of Pascal Donoghue and Peter Burke, because it doesn't there's no if it doesn't affect our exports, like what's their rationale in postponing it? Because I understand that they don't believe, am I right in saying they don't believe in getting rid of the idea completely? It's just like postpone. Is that the case, is it?
Yeah, but that is what the industry always say. You know, a real big tactic within the industry is to say, oh, you know, the labelling is grand, it's fine, just not yet. Put it on the long finger. So delay is a tactic of the industry. And I really would say that, you know, there are senior government figures who have fallen for the alcohol line on this. Why they've done that, I can't say, but all I can do is to point to you know, the rationale for having these labels in the first place, to which the whole of the government, and you know, if you go back to when the legislation was passed in 2018, there was support from right across all political parties for this legislation. And indeed, it was actually introduced in 2015, the legislation was introduced by then Health Minister Leo Varadkar and was brought to fruition by Simon Harris when he was Health Minister in 2018. So it is particularly shocking to see Simon Harris saying that, you know, in his view, there needs to be a delay on these labels, because he is a minister who would have seen the very intense lobbying of the alcohol industry. And all we can just is to say that it's really to appeal at this point, I think, to Micheál Martin, the Taoiseach, to step in and to take ownership of Ireland's public health legislation.